COVID-19 is a complicated disease with many different symptoms and unfortunately outcomes. Over the last year though, as more and more data is generated, a slightly clearer picture has emerged, including some possible serious effects on fit, healthy and active people like cyclists. So in this video, we are going to look into that and also try and answer the question of how you can best get back to riding after you've had COVID-19. Before we start, let's have a quick recap as to what COVID-19 actually is so that we're all on the same page. It is an illness that is caused by a type of coronavirus, of which there are many. This one though is called SARS-CoV-2. Now it's increasingly thought of as a vascular disease that's spread through respiratory pathways. So what that means is that it's not just your nose, your throat and your lungs, but also your blood vessels, your heart and other organs besides. Now you don't need me to tell you how serious it can potentially be, but even milder cases of coronavirus can have symptoms that go on many months after the initial infection. So some patients are reporting chest pain and heart arrhythmias and shortness of breath and debilitating fatigue many months after they initially got COVID-19. But there are also other potential effects from even milder COVID-19 that would have serious consequences for active people, particularly like cyclists. So although rarer, COVID-19 can sometimes affect your heart in various different ways. Myocarditis being one, which is inflammation of the heart itself. Pericarditis, which is inflammation of the sac surrounding your heart. And then also heart arrhythmias, like atrial fibrillation. One early study suggested that as many as a quarter of all athletes who'd had COVID-19 showed signs of myocarditis afterwards. Now, subsequently, a piece of research from Vanderbilt University Medical Center that tested a much larger cohort of people, including non-athletes as well as athletes that hadn't had COVID-19, fortunately showed that the incidence was much lower, although in part that's because 24% of all athletes that hadn't had COVID-19 that they tested showed signs of myocarditis anyway, but it increased to 27% when they were testing athletes that had had COVID-19. Still, 3% is significant, particularly when you consider that 107 million people have already had COVID-19. So it would be really good to get some specific guidance. In the first instance, I reached out to Dr Jon Greenwell, who works with Team EF, because I wanted to find out what protocols a World Tour team would put in place in the case of a rider who had COVID-19. Now, clearly from his response, it seems like cardiac issues are a real concern with them too. So he said in the first instance, they would check cardiac enzyme blood tests. So that effectively will tell you if the heart has been under stress. Then complete rest for 10 days after the symptoms have settled. Now that seems like a long time in the world of professional athletes. Then once past this window, we check a resting ECG, then an exercise ECG, then an echocardiogram to look at cardiac function. He then says if those tests are normal, we would allow the rider to restart training. If abnormal, then we would do a cardiac MRI. If this was abnormal, then they'd have to rest for a much longer period of time. Now, I don't think there've been any cases in professional cycling of that, but Dr Greenwell does work in other sports other than cycling. He said he's had a couple of endurance athletes that have been off training for 10 and 8 months respectively following presumed initial infection. We say presumed because actually it was so early in the pandemic that actually they didn't test for it back then. Now that level of investigation that's available to pro athletes just isn't going to be for the majority of us, I wouldn't have thought. Healthcare systems are stretched to breaking point as it is without me then walking in there asking for an ECG just so that I can start racing on Zwift again. So to give us the right information for the rest of us, we are going to speak to Dr Alex Hyam, who's actually an ex-professional cyclist. He's also a GP here in the UK with, as you can imagine, a special interest in sports medicine. Alex, thank you very much for joining us. Firstly, can I start with an easy one? What do you do if you've had symptoms and a positive diagnosis of COVID?
Okay, so the first thing, the most important thing is to self-isolate. The current British government guidance is to self-isolate for 10 days. And then if you're symptom-free at that point, you can head back out. If you're still symptomatic, you need to wait until you're symptom-free before you leave isolation. from a cyclist perspective, the evidence is clearer from the BMJ advice, which is 10 days from the onset of symptoms and at least 7 days after your symptoms have settled down. Then you can start thinking about resuming or starting the process of resuming exercise.
Okay, and what kind of symptoms are we talking about here? Because some people report things like taste that doesn't come back for a long time. Is that a symptom that you've got to count for your 10 days, or is it just more kind of serious ones, acute ones?
You're talking more serious ones. So fever being the primary one, shortness of breath, cough. Although the cough is a difficult one because a lot of people do have a cough for a prolonged period of time. So if you've got a severe worsening cough which is productive, then that's something which you should be more concerned about. Diarrhea is a common one, gastrointestinal disturbances, vomiting. So those sort of things you should definitely be considering as the major symptoms.
And then what about long COVID then? Is 10 days long enough, do you think, to kind of mitigate the risks of going into long COVID, or is it not clear actually what's causing it at the moment?
I think it's really unclear at the moment as to exactly what the factors are. There's some nice studies which are in place at the moment, but we don't have any data from, looking at whether there is a subset of symptoms which people are more likely to present with initially and then go on to have long COVID. But the data from it isn't clear. I mean, reference your initial question, is 10 days long enough? Probably in most people 10 days is long enough. As long as you do rest really well and then listen to your body when you're coming back. It's that difficult one with people who generally perform best. You want to drive things forward and get back onto exercise sooner rather than later. I think if you can hold back and you're not feeling 100%, give it a little bit longer. But 10 days should be adequate.
Okay, and then what about the cardiac risks? What symptoms should we look out for? I mean, everyone, but specifically for people that are looking to get back into exercise.
I think there's a big overlap between cardiac and respiratory. The overlapping symptom of the two is shortness of breath. And if you've got excessive shortness of breath for your relative perception of exertion, so say walking up the stairs, you're going to get short of breath, but if it's much more than you'd expect normally, then that's not a great sign. Chest pain is the classical one. The thing with cardiac chest pain is it tends to be a dull ache, but it can be sharp in some of the symptoms the symptoms associated with COVID. It can be more of a sharp pain. I don't mean that. One of the differentials would be pericarditis, and that's worse when you're lying down or leaning forward. But any chest pain is probably worthwhile chatting to your family doctor or GP about whether it's something which you need to run some further tests for.
I mean, if that doesn't settle down, then that is something that would definitely keep you off the bike, right? Yeah,
I'd definitely say stay off the bike until you've had it checked out by your family doctor or a physician, yeah.
Now, one thing that I'm struggling with, I think I've been diagnosed as medical student-itis, because basically all the research I've been doing, any kind of ache or pain or twinge or whatever, I'm sort of immediately thinking like, oh, maybe I've already had COVID, I didn't know, and now I've got myocarditis or pericarditis or anything like that. So for people like me, idiots like me, how serious is it? If I was wearing a heart rate monitor or a wearable device, could you see signs in data basically if you're monitoring yourself?
Yeah, I mean, I think so. If you're talking specifically about myocarditis, one of the most common things we see is arrhythmias generated by that. So if you're getting periods with a Whoop or another device that you're wearing where your heart rate's very or goes up quickly, is much higher than would be expected, then that's an indicator that something's going on. I think it's always very difficult with symptoms, patients presenting to me with symptoms. I think if you've got persistent symptoms lasting longer than 2 or 3 days that are causing you concern, discuss it with your doctor, because it is difficult to differentiate.
But the overriding thing then is to actually take this 10 days off after your symptoms resolve. Basically, that seems to be the gold standard.
I think that, yeah, that's what we've got from the data so far. Is 10 days seems to be a gold standard. But I mean, I think the real thing is learning to listen to your body. In my experience, you can get a double dip, so improve initially, and then 2-3 weeks later start to go backwards as you try to ramp up what you do. I think learning to understand that the feedback from your body is really important. And if you're feeling tired, you take more time off.
Alex, that's been brilliant, super helpful. Thank you very much.
No worries, though.
I've got to say, I do feel quite reassured having spoken to Dr. Hyam there. I got myself worked up into a little bit of a stew, but it does sound like as long as you don't bury your head in the sand, as long as you give yourself adequate rest and you listen to your body, and if there are any symptoms that linger on, particularly ones that get worse on exertion, then you go and you speak to your local doctor. Getting adequate rest isn't necessarily that easy though. 10 days off the bike could be pretty brutal, and I say that as someone that can barely take 3 off the bike, but this is really, really serious and it's worth doing. And actually, I was reading an article on Training Peaks and a quote jumped out at me. It was written by a guy called Adam Mills, and he said, basically, the traits that can make a cyclist successful can also be the ones that betray us. And this bit was a really important bit. Basically, if you have a few days off at the front end, then it can mean many, many, many more happy days of training in the midterm and the long term. So, is 10 days of mild torture worth a lifetime of having to hold yourself back? Yeah, 100% yeah. Now, lastly, one point on vaccinations. Our mates at Whoop, who have that wearable device that generates heart rate data 24/7 and then unlocks all sorts of insights like sleep data and recovery data and strain data, have some really interesting insights from Whoop users who have had the vaccine. And they showed that actually more than double the number of users had a red recovery score on the day after they'd had that vaccine. But unlike the data that Whoop users see when they get COVID, actually that red recovery score bounces back on the day after. So if you are lucky enough to have the vaccine, have an easy day after, and then sounds like you can just crack on as per normal. As time goes on, a clearer picture of the effects of COVID-19 will undoubtedly emerge. There are some big studies going on at the moment that may well tell us whether or not it is worse than other viruses for cardiac effects, or whether or not the prevalence at the moment is more a factor of just how many people have become infected with it in such a short space of time. Still, undoubtedly the single biggest thing you can do is just not get COVID-19 in the first place. For the benefit of humanity, the fewer the people who are infected, the better. But also for you as an individual, it reduces your risks of any possible long-term complications. And of course, it means you don't have to take 10 days off your bike and indeed get stuck in your house. Hopefully, that's not too late for many of you out there who, I guess, statistically will have already had COVID-19. Make sure you let us know in the comments, actually, if you have had it and also how you found your recovery from it. Not exactly scientific research, but it'd be interesting anecdotal research, and I'd look forward to reading those comments. Before we leave, I just want to say a huge thank you to Dr. Alex Hyam for his time talking to us today. Also, Dr. Jon Greenwell as well, and many other contributors actually who've been helping out with research behind the scenes. If you have found this video useful, please give it a big thumbs up.